All right. Everybody ready? Good afternoon. Welcome to Emergency Response Committee. We will begin roll call. Mr. Matthews.
I am here remotely.
All right. Mr. Matthews online. Mr. Blau.
Here.
Mr. Taylor.
Here in the BOCC room.
Mr. Davidson. Here. And Barnes is here in the BOCC room. We have all members present, either online or in the room. So first item would be, let's see here, I'm halfway lost today. Discussion possible action to set date, time, and place meeting will reconvene in the event of technical difficulties that cannot be corrected in 30 minutes.
How about Friday at noon?
Friday at noon?
April 24th at
Should-
noon in the BOC room.
Should we first do a motion to reconvene?
That would probably be helpful.
I'll second Joe's motion.
All right, I got a motion second to reconvene. Roll call, Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Further discussion on recommendation for April 24th, Friday at noon in case of technical difficulties.
I'll make that motion.
All right, got a motion. Do I hear a second?
Second.
Got a motion and a second. Roll call, Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Very good. Item number 3, discussion, review, possible action regarding a presentation from emergency management, health, and safety professionals. Do I hear a motion to reopen?
So moved.
Got a motion. Do I hear a second?
Second.
Got a motion second to reopen. Item number 3, roll call, Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Today, in addition to coronavirus, COVID-19, we are obviously monitoring severe weather issues. Had significant severe weather overnight last night, and threats continue in much of the state today. As you can see in the radar image behind Mr. Blau, particularly central, eastern, and northeastern part of the state has substantial activity, and we're expecting some revitalization of that to our west and southwest today. And this afternoon may get a little bit bumpy, so we'll continue to monitor that. Regard back to coronavirus update, persistence in our preventative measures, including limiting travel and staying at home, is now more important than ever. Still under presidential disaster declaration, including all states, and the presidential memorandum that did approve 100% federal share reimbursement for use of National Guard in Oklahoma is still in place. And the reopening strategies continue to move as we see changes and revisions throughout the country, different municipalities, different counties and states. And local guidance is still being developed in that regard. CDC specific guidance, recommends wearing a cloth mask when around other people to help reduce potential spread factors. And they encourage all organizations to continue to use their business continuity of operations plan. And Homeland Security, in collaboration with Mexico and Canada, have closed the borders, international borders, for an additional 30 days. And Oklahoma is under a major disaster declaration. Thank you. And a catastrophic public health emergency. This includes public assistance category, providing funding for emergency protective measures and direct federal assistance. And I'll talk more about that in a little bit. Oklahoma County has registered for the CARES Act stimulus funding, which is not related to the disaster declaration funding. That is a separate issue. In Oklahoma, currently looking at 2,894 positive test results, 923 of which are active, and there are 170 virus-related deaths, with the largest numbers still in Oklahoma County, Tulsa County, and Cleveland County. And as of September 1st of 2019, there were 84 seasonal flu deaths. Still looking at over 32,000 negative test results. 68 counties in Oklahoma have positive cases, and we know of 1,702 Oklahomans who have recovered from known COVID-19 infections. 96 test sites now in operation around the state, and specific guidance is available at the State Health Department website in regard to prerequisites for going to some of those. Some of those you can just drop in. Others require scheduling appointments, as is the case with the Oklahoma County site. And the State Department of Health has activated an online symptom tracker. As we talked about previously, this is a key documentation factor in the reentry of the reopening process. We are still under a gubernatorial declaration of a catastrophic public health emergency, and Governor Stitt did modify executive order to allow elective surgeries to begin April 24th based on a tiered acuity scale. And Integris reportedly began some outpatient elective surgeries on the 20th. And the governor's office did provide additional clarification on the 20th. Minor medical procedures and non-emergency dental procedures may resume April 30th for those offices and practitioners who have adequate PPE for their staffs. Projected peak for Oklahoma now anticipated to be passed, and peak resource use continues to decline per the Institute for Health Metrics and Evaluation, although that does include full social distancing through the end of May.
David,
Sir.
may I ask you a question on the Oklahoma peak? I've heard
Yes.
recently that the peak date has been moved out to April 30th, and I thought I heard you just say we had reached our peak.
Actually, the last peak that I saw through the Institute for Health Metrics and Evaluation was April 21st, and I've also got documentation that shows it to be as late as the 26th. So it's going to be back to the ambiguity that I've mentioned on several occasions, depending on which statistics and what preventative measures and the metrics that they're applying to that. So I think in a broad scale, it probably would suffice to say that our peak is somewhere the end of this week or first of next week, because that range takes in the dates I keep seeing.
Okay, and then on that, whatever that peak date is, have you seen any change on the peak date being dependent upon carrying out social distancing, closures, things of that nature, to the conclusion of May? Or is that date still being determined based upon continuing to do the things that we're doing today through the end of May?
The initial projected peaks were dependent upon full social distancing, what we're currently experiencing through the end of May. There's obviously going to be some variable in regard to that, the dynamics, as some things are beginning to open, some things are being allowed that were not previously allowed, and those will definitely affect peak times as well as case. The reentry, the reopening is in great part dependent upon, obviously, testing capabilities, accuracy of testing, and what numbers are derived from those activities. If you see a surge or continued increase, then there's going to be some backpedaling or at least some reservation in regard to reopening and reentry issues. If the numbers continue to decline, particularly for a multiple day period, you will see additional reentry measures being implemented.
And I think that declining period for those additional reopening is kind of a 14-day window, right?
Correct.
Consistent and
Yes,
sustained. And so is it accurate to say that rushing to reopen may result in a second wave, as some of the national health experts are talking about?
I think that is definitely a very viable dynamic. There's multiple factors involved, but some other places, other locations who have gone through what I would term extensive reopening or reentry have in fact seen increases in numbers, and some to somewhat considered dangerous levels. So it's going to be, again, a variety of personal protective measures that are implemented and the successes we see in the monitoring and surveillance activities in regard to cases and symptomatic, keeping in mind that asymptomatic folks can still be transmitting the virus. That is a significant dynamic, and that's where the testing and the accuracy of the testing, both availability and accuracy, continue to be significant factors.
Right. Okay. Thank you, David, for answering those questions.
You're welcome, sir. Public safety answering points or 911 centers are still receiving positive case addresses if they're sending first responders to a location where they've had a known positive case. There's no personal information provided, just the address that there was a potential risk factor there. We talked about Oklahoma National Guard deployment. They have been authorized to work with the State Department of Health on nursing home related medical missions. And my last information from a representative at the Guard said that there were 175 members assigned to other tasks, typically medical related, with the exception of the Regional Training Institute, where the Governor's Solution Branch continues to meet. They are also assisting with strategic national stockpile distribution and management, and they're assisting the health department with field assessments. DEQ offices remain closed, but environmental lab is open to the public, information online. Oklahoma Department of Public Safety, as we have mentioned several times, has suspended face-to-face services, but some licensure and handicap parking permit expirations have been extended, and some online or license renewals are available. Latest report from Oklahoma Department of Corrections remains at 5 staff members and 1 inmate having tested positive. And according to some information I was reading on their site earlier, 431 inmates have been tested as of April 20th, but they still only have the 6 positive results. Oklahoma County in general, still looking at 590 positive cases with 24 fatalities and 395 total recovered. Drive-through site approaching 3,500 tests with 172 positive as of 4/21, April 21st. Last report from Tinker was still 22 positive cases there, and they still have restrictive visitor guidance in place and revisions in available gates. Oklahoma City County Nurse Hotline for questions on the virus is still 425-4489. It's still active. We mentioned that Helping Hands under the Mary Mahoney Memorial Healthcare Organization is helping oversee testing processes for shelters. They do not have the capabilities to provide widespread testing, but they are helping to ensure that tests are being properly performed and that follow-up is being provided where applicable. Multiple telehealth providers, both for physical and mental health, are coordinating efforts, and they're using nursing students who are needing training hours to incorporate into that for assistance and obviously under proper supervision. Alternative healthcare homeless shelters involving the Homeless Alliance, Oklahoma County Social Services, and other partners continue to work through agreements and contractual issues. And City County Health Department is providing a path for supporting shelter efforts. And Christy Jernigan Marshall, Oklahoma County Social Services, is involved in many of those planning efforts and ongoing meetings. Grace Rescue Mission is relooking at the code issues, and the last report I got there was that Oklahoma City Fire Marshal arrived and was extremely helpful in coming up with alternatives and was making adjustments in that facility so that they can continue operations. So that was a very positive thing. The Alternative Care Site Initiative, not the same as the Homeless Alternative Care project, continues to move forward. PPE is still a concern for first responders and healthcare workers, and the Oklahoma County Emergency Management Point of Distribution remains in place. And we placed an additional order, the weekly order, yesterday, and expect materials to be arriving tomorrow. We'll be again distributing. Currently, we're looking at over 50 jurisdictions and some counties outside Oklahoma County that we're providing those to, the public safety entities, the first response agencies, plus some local universities. And juvenile justice in Oklahoma County Jail is also involved in those distribution efforts or recipients of. City County Health Departments still requesting donations of basic items. If you have any items, you can go to their website, PPE donations at Oklahoma City County Health Department or OCCHD.org for additional information. Will Rogers World Airport is still reporting a significant reduction in passengers. And again, reminders on severe weather sheltering. Make sure you're making a plan early and try to maintain social distancing and maintain awareness of the weather factors. Internal Oklahoma County government, ReadyOp, continues to be emphasized, and registration is available through HR Safety Office with Mr. Matthews. We are still under an emergency declaration approved March 25th, and the Oklahoma County Court Clerk Office is still providing marriage licenses, bring the paperwork already prepared, and an appointment is necessary for that. I was advised we had 121 folks through the door yesterday, and 40 prisoner shuttles, with 15 prisoner shuttles anticipated today. And additional draft re-entry information updates are coming. I would note that I participated, excuse me, in the required disaster declaration applicants briefing. This is a normal step in any federally declared disaster. They have an applicants briefing early in the process. And we had that briefing yesterday. Nick Rutledge in my office also participated in that. And there's going to be additional guidance coming on that. As normal, we're looking at a 75% federal and 25% non-federal reimbursement. There is a $3,300 minimum project worksheet amount, and I feel confident that we'll be able to meet that threshold. It's unsure currently where the CARES Act is going to overlap, collide, work in concert with, or whatever. Don't really know how that's going to work because you can't take federal funding from multiple sources for the same issues. So,
Hey, David,
I asked that question during the briefing, and it had not been answered. Yes, sir.
did they answer how they were going to, what they were going to look at to give money to the CARES Act? Like how they're going to dole it out?
How the CARES Act will be distributed?
Yeah.
No, they did not. This was specific to disaster funding. I actually asked that question during the webinar, as did my counterpart in Tulsa, because they are also a participant in the CARES Act. And they preferred to defer those discussions to times when it's specific to the CARES Act, because this was really focused on a disaster declaration. Yeah, we had the same questions, and particularly that potential duplication of funds is a significant point of discussion.
Yeah.
I did receive some contact from local communities in Oklahoma County, and that is in regard to the CARES Act again. And obviously, there's a lot of information yet to be received regarding the CARES Act, and specific to Mr. Davidson's question, potential distribution and how that's actually going to look. Some of the small communities in Oklahoma County that are experiencing significant financial loss and hardship, and certainly will carry into likely the next fiscal year, we're wondering if any of that is going to be distributed or broken down from the county receipt to local jurisdictions, which we have no guidance on that either. But in regard to that, I was discussing with the state, and there's a gentleman out there named Alvin Graybill, who is the recovery director for the State Office of Emergency Management, and he and I have been discussing something called the Community Disaster Loan, or CDL program. This is a program, excuse me, that is under FEMA. It is rarely used. He told me he did not know that it had been used in Oklahoma in the last 20 years, but it is still on the books. And he sent me a fact sheet. I provided copies to the folks that are here on the committee. And Mr. Matthews, I'll get you a copy of that electronically. Very basic, frequently asked question sheet, but could be low interest loans and at the long-term loans, and 10-year for repayment possibly. Several minor points and simple points, I shouldn't say minor, but simple points to meeting the qualifications of that. And Mr. Graybill has advised me that the state has applied for that. Mr. Gower, State Director, has allowed Mr. Graybill to apply for that, and we're still waiting on additional information. But in reading this information and some other things that he provided to me, this does look like a potential funding stream or funding opportunity for some of the smaller jurisdictions that would not have qualified for the CARES Act based on population numbers. But again, could be a potential funding stream to help offset some of the experiences that they're currently having in the current fiscal year and anticipated the next fiscal year with the loss of revenues. So I'll continue to monitor that and be in contact with the state. And should that be approved by FEMA, I will be sure and get that information distributed to elected officials and to jurisdictions within Oklahoma County. I have submitted a request for public assistance. As I've been saying, this disaster declaration is what they call Category B, which is emergency protective measures. And this is under the PA, the public assistance side of disaster declarations. And I have submitted a request for public assistance for Oklahoma County government, and that is currently under review. That and the applicant's briefing are really the two upfront early preliminary steps in moving towards those reimbursements. So we're moving through that process. Some notable, Oklahoma Medical Reserve Corps is soliciting continuing to solicit medical and non-medical volunteers for a variety of opportunities. The warning signs and symptoms on the virus have not changed in any significance, and personal protective measures remain consistent, and everyone's encouraged to continue practicing those and following those. Blood supplies have been significantly reduced because of fewer people going in to donate and the blood drives being shut down. So American Red Cross and Oklahoma Blood Institute would still request that people do donate blood. And again, the encouragement or the warning, however you want to look at it, to avoid false information, particularly social media reports, and make sure you're looking for known, credible sources, and still are not aware of any authorization letters for essential services or personnel issued or being required. And would also encourage viewing statistics, as Mr. Blau mentioned earlier, statistics in regards to the projections. There's a lot of dynamics. There are a lot of, in some cases, ambiguities depending on who you look at for statistics. So be sure and not let hype affect you, but certainly take a look at those numbers and, again, use credible source. I believe that concludes my report with the exception of any questions or further discussion.
Our March 25th emergency declaration, it shadows the state, or we have an end date on it?
It shadows the state. It runs concurrent with the state declaration.
And did they have an end date with theirs?
No, sir. There's actually, when disasters are declared, you typically have a declaration date, and then they assign, at some point, they assign a time period, the parameters of beginning and an ending date for that declaration, and that's when you're looking at reparation and different reimbursements between those dates. But this particular disaster is still open-ended, has not got a close date, federal or state.
Thank you.
Any other questions or discussion?
Motion to receive report.
Got a motion to receive report. Can I get
Second.
and a second? Roll call, Mr. Matthews.
Aye.
Blau.
Aye.
Mr. Taylor. Mr. Davidson.
Aye.
And Barnes is an aye. Item number 4, discussion review possible action regarding presentation from BOCC departments. Anyone wanting to present or any information received? Mr. Matthews or anyone get information from any BOCC departments?
I have not received any.
Hearing none, we'll move to item number 5, discussion, review, and possible action regarding presentation from facilities management. Any discussion? Hearing none. Item number 6, discussion, review, and possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor, or their offices. Anyone present or have information to present from those offices? Hearing none, I believe we are to item number 7, discussion possible action to determine next meeting date and time, which we have our next regular meeting set for April 27th at noon. We want to look at status for this meeting.
You want to go through 4 comments? We still motion to recess.
We can certainly do that. Board member comment? I'm sorry?
It's all right.
Yeah, board member comments, Mr. Matthews,
No, thank you.
Mr. Blau?
None. Oh, David,
Sir.
just real quick, not that although I have this wonderful weather map behind me, radar image, courtesy of you and your staff. I took a look at the river gauges, and best I can tell from looking at the hydraulic page on the National Weather Service, one gauge, they're not anticipating any flooding. I believe that was the Jones gauge. The gauge down around Hera, they don't have any forecast for. And I ran it out, I think it was 5 days. So they're not forecasting any flooding.
Very good. and looking at, and remembering where the heaviest rainfall was overnight, typically the northwest area up towards Canton and actually Logan County, Kingfisher up in there is a big issue for us coming back downriver and getting through Oklahoma City and eastern Oklahoma County. And those areas were not inundated by any means. They did receive some heavy rainfall, but when the wall went up out in the El Reno area, it kind of shut the storms down last night. So that's definitely to our advantage. Depending on what happens today, again, those areas received some this morning, but I don't believe it's going to be significant enough to give us any flooding issues unless something changes this afternoon. Appreciate you looking at that, Joe.
Yes, sir.
Any other comments, Joe?
None, thank you.
Mr. Taylor?
No, thank you.
Mr. Davidson?
No, thank you.
And none from Mr. Barnes.
Mr. Chairman, I make a motion that we recess until Friday, April 24th at noon in the VOCC.
All right, do I hear a second to that motion?
Second.
Second.
Got a motion and a second to recess until Friday, April 24th at 12 noon in the VOCC. Roll call, Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Taylor,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. We stand in recess. Thank you all for your participation. You brought me an open water.
No, I didn't.
Did you open it?
No.
It was open. Yeah, I was afraid to start
Are
sucking
you
on it.
serious?
Yeah.
I got another refrigerator.